A very good day, my dear postgraduate students. The class for the day, or rather a narration, is way off the mark. I thought it would mean something for the first year PGs, but then it had enough material for the second years, if not the final years. Final years, of course, have got only a few months more for their examination, but still it would do them some good. And the topic is perception about the MD course. I hope you are able to perceive something on the screen. So it is a message for PGs for the year 2023. The question is there very much on the screen. How many legs does this elephant have? So you and I can start counting and then we'll come to a kind of a consensus. So that is what a perception is. What I think might not be applicable for you, nor what you think might be different from what your colleagues think. A perception is more of an inner concept. So, how many legs does this elephant have? To which I have given the title as perception. We have already seen this recollection n number of times. The broad division of the curriculum in pathology. As far as theory is concerned, you have got a general pathology, systemic pathology, applied medical and surgical pathology, recent advances, hematology, technical applications, and maybe something else. Amidst these also, there might be a kind of an overlap, and finally, your examination paper is condensed to 4. Recently, the National Medical Commission has also given a different terminology, but all will be falling within this. So, a general pathology, systemic pathology, applied medical and surgical pathology, recent advances, hematology, and technical applications. We should be having these in mind. As far as the practical is concerned, these will be the exercises. I might have missed some or included some which is not there in your center. But then, broadly, you have got an exercise in clinical pathology. Autopsy, nowadays it is usually assembled. Gross specimens, it is different from autopsy. You will have to describe, come to a gross diagnosis for which the small discussion can be there. Cytology and hematology slides on day 1. Histology slides on day 2. Histopathological techniques. It can be section cutting, routine and the special stains, as well as the PAPS staining. There might be a grand viva towards the end of it. And finally, in front of your colleagues, you have to present a lesson, which is called as pedagogy. So this is the general division. Always I used to tell my students, if you are going to be aware of the questions, 25% of your job is done. Leave alone the answers. So we have seen the theory and the practical. Common sense is not so common. Voltaire. This can be a very important and a pertinent message for the day. Because We do think of the recent advances, the ultimate recent advances, and the molecular and even the markers that are being employed in pathology in the recent days. In the process, we forego the fundamentals and the basics, or even move the undergraduate portions. In the first years, I would advise the students, probably you people will be about 1 month or 2 months old in the department, and it is the right time for you. My personal observation is the students are now without a sense of direction. This is what you people will have to exactly do in the first year. Routine departmental work. You are not a non-clinical department, you belong to a clinical department rather, and there will be a lot of this routine departmental work. And each section might have developed in its own cytology, hematology, histology, clinical pathology, so on and so forth. On the other hand, if you are a student at a medical college, you have the advantage of teaching the undergraduate students. Small topics should be given to you people as tutorials. And you will be supplementing the faculty, the professors in your institute. Definitely, you will be an armamentarium in the teaching of practicals in the department. So you will be personally handling the batches of students allotted to you. Seminars assigned to you as a postgraduate student, journal club, etc. Interdepartmental activities. It can be an academic society meeting or an interdepartmental presentations, so on. The clinical and the academic meetings, wherein you analyze and present a set of cases on behalf of your department. You may be either independent or forming part of a team. So this is some of the routine work that you people shall and will be doing and shall not desist from. What I would advise you people is, in the meantime, you collect the questions. And when I say questions, I always tell my students, collect the undergraduate questions, collect the postgraduate questions. Assemble the material from your seniors. Your seniors are already a temple of experience. They would have done many a thing the wrong way, struggled, and finally they would have found out a solution. So definitely they are the best people. So also the junior faculty in your department, the tutors and the assistant professors, etc. So you can assemble the material from them also, and they will be fresh with their thesis, with their examination, their mode of preparation, so on and so forth. What I would advise the first years is this. From the R.A.T.S, which I have covered until now, I would like you people to kindly cover all the undergraduate topics, particularly non-neoplastic topics. And the target time for the entire UG portion is 1 month. Of course, if you people are able to define an aneurysm, mention the theories of atherosclerosis, differentiate between bronchopneumonia and lobar pneumonia, and what are the sites of primary tuberculosis, etc., you people need not do it. Also, if you people can define an embolus, shock, etc. offhand, please avoid this section. But we must know how many of us will be able to do it fluently. In the exam, there might be 8 or 10 students per day. And it is not a question of whether you will be answering. How fast and how sure you will be with your answers matters most because the external examiners are going to judge you in a day or two. So this will be making a lot of things. Go back to my quote, common sense is very uncommon. What is the point in answering a molecular basis of pathology when you people cannot answer a fundamental undergraduate test? And also, simultaneously, I would advise you people to go through the routine classes that are being collected and presented in R.A.T.S. This will be including undergraduate as well as postgraduate classes. To my knowledge, the undergraduate portions are more or less over, but it shall form a very strong base for our postgraduate knowledge. So that will be for the first years. Hope the material is very clear. First things first. Always do the first things first and the second things not at all. Peter Drucker. A wonderful saying. Always we have a tendency to postpone. And the problem is we are more analytical. It is not that we do not have time, etc., or that we are lazy. These can be excused, but then we are analytical. In what way is it important? It is an undergraduate question. Why should I be knowing it? And so on. But ultimately, you people kindly take it from me. 99.99% of your questions is going to be from these. And Peter Drucker, incidentally, an amazing person. Playlist is one thing that I find that the students are not aware of or not aware of to the adequate extent and are unable to utilize. I would very much advise you people to go to the playlist of R.A.T.S, wherein I'm compiling the chapters topic by topic. For instance, if you go to the playlist mentioning recent advances, you will know what are all the topics that have been covered. If it is going to be histopathology techniques, you will know what all has been covered. Or if it has been something from general pathology, you will be knowing. Technical topics in pathology, there is a column for it. The playlist will give you a total idea about it. Otherwise, you are lost because more than 300 topics are there right now in R.A.T.S. And it is very difficult for a student to find a topic to his need or liking at a particular moment. Not worth searching, go to playlist. Without playlist, you will be missing it. And this, incidentally, is our gentleman, Peter Drucker. What is amazing is, look at the column of books that are adoring his shelf. Books. A good book is the precious lifeblood of a master spirit. And a latest trend among students and postgraduate students is not to have books. They have a pad in which everything has been downloaded. It will not be equivalent to a book. Kindly go through the physical form of a book. Weigh it, touch it, turn it, underline it, make it look old. That is exactly what we are not doing. And once a book is there, there will be a continuity of recollection. So you will be able to go to the first classes when you touch the last pages of your book. There is a psychological connection which I would like you people to very much take advantage of. I know the volume of pathology, not possible for you to buy and hold all the books. But then you need at least some basic books in each of the section. Robbins, of course, is there. And I've already mentioned, it can be Ackerman or anything else for the surgical pathology. Then you need one book for the histopathology techniques and hematology and so on. Also, any of the other compilations that you have got by attending a conference or so. Your notes, of course, will be forming one of the best parts of your armamentarium. So this is one. A good book is the precious lifeblood of a master spirit. And library is supposed to be a temple of knowledge. We never go there. For the second years, again, the same thing is being repeated. Routine departmental work, teaching the undergraduates, teaching practicals, seminars that have been assigned, interdepartmental clinical academic meetings. It is a repetition. Please do not desist or resist any of these. Also, you will be having to concentrate on your thesis. In fact, you should have started well in the end of second year. So this will be the peak in which you will be passing through it. Teach your juniors. Teaching is one of the best ways of learning. And there has to be a speed developed in your routine work. Whether it is going to be a grossing or a hematology or a screening or doing an FNAC or briefing the students, there has to be speed because time is against us. That is why I have mentioned it as R.A.T.S, racing against time for students. Collecting any additional material that you need. It can be from the workshops, it can be from your colleagues, whatsoever. Conferences, attending them, and again, having a compilation of that knowledge. The external postings, these are very much needed. For example, our students can be posted in the cancer hospital, or internally they will be posted in microbiology, biochemistry, etc. Also, the students are being posted for autopsy in Bombay. So these are important things. And kindly collect the university questions. There are, of course, people who have already done the work, but this will render very little to us because we do not know what they have collected. As my professor used to say, it is only from the mouth of the lecturer to the ears of the student without going through the minds of either. Neither the teacher thinks of it nor the student. And nowadays it is still worse. We are just downloading. It is going to be from one computer to another without anybody's mind. So collect the university questions, compile it chapter-wise. If possible, mention the pages of reference. Again, I'm giving you the same thing, but there is a difference. You are supposed to revise all the UG topics very rapidly. And the target time I have given now is only 10 days in the second years. Believe it or not, one of the external examiners had asked my seniors. The question was, what is the difference between petechiae, purpura, and ecchymosis? Define neoplasia. Define shock. What is an embolus? And definitions are definitions. No one words, please. And you people will have to find out what anything means. What is a paradoxical embolism? What is an infarct at a distance? Many such things are there. So I would like you people to kindly again go back to the UG topics. If you know it well, you can fast forward it. And secondly, all the routine R.A.T.S classes. This should be apart from all the other things that you are doing. When I come to the final years, again almost the same thing. There is a routine, then the teaching of the UG. This will never stop. Do not expect somebody to bail you out. Teaching in the practical seminars as in, because this will give you an air of confidence. Finally, in the pedagogy, you will be an excellent teacher and then there will be positive remarks about you. Clinical and academic meetings will be making you more of a confident person so that when you go out as a faculty to another institute, you will be sounding confident and knowledgeable. And thesis has to be completed. My idea will be at least 3 months prior to the deadline offered by your institute. Teach your juniors, not only the subject part of it, but then the technicalities. Organize your teaching material, conferences, peripheral postings, external postings. This will be continuing again in the final years also. So third time again I'm saying, but in this case you'll have to revise all the PG topics in a period of 1 month. You should have read it by this time, but then again in a period of 1 month you are revising all the PG topics from R.A.T.S. That might include recent advances, that might include histological techniques, or it can be something from autopsy and so on. And finally, it has to be completed well before the time. Even then, I warn you, it is still an incomplete effort of mine. 1 pound of learning requires 10 pounds of common sense applied to it. So, you people should be knowing what common sense is. I cannot be answering the latest classification of the neurogenic tumors without knowing the difference between a red infarct and a white infarct. Common sense, which is extremely uncommon, and students fumble with it. Do not try to prepare only the chart that is given to you. You may be asked questions of it because any examiner will sense that you know the diagnosis. So also the specimens. The questions will go like this. What are the other tumors? How do you differentiate? So on and so forth. My target for the PGs is this. First, the UG part of it. Cover the UG questions for the PGs. Except neoplasia, I think this will be applicable and recommended for the postgraduate students. UG questions in hematology, again except leukemias. Anything like megaloblastic anemia or a sickle cell anemia or a spherocytosis can very well be read from this. The UG slides, not because they are going to be asked in the exam, because you people should be very familiar in teaching your students. And any of the PG practicals, UG practicals. And coming back to this, the postgraduates, you people will have to know the technical theory questions, the recent advances, autopsy techniques, histopathology techniques, and gross specimens. So I am trying to cover what little I can for the postgraduates. And kindly go to the playlist and see what all I have covered. Go to the playlist alone. That alone will give you an idea. And what I have not included for the PGs will be this. The PG slides. It is never exhaustible. Also, you people should be knowing that 50% of your slides will be non-neoplastic slides. Any of the theory regarding the malignancies, I am willfully avoiding because given well in your Washington, your Ackerman and your WHO. Robbins, there is rest of it other than the undergraduate questions. The idea of the UG question is it will take you to the book and you will know what is in between. Mucoviscidosis is a question for you. Lysosomal storage disease is a question for you. Cardiomyopathy is a question for you. So also Alzheimer's disease and so on. So those will be read by you people. Of course, the molecular pathology, genetics, and miscellaneous, certain other things, these are not included for the PGs in my classes. It is your business to read because time and tide are against both of us. So life is more like a marathon. And imagine this man winning. There is something that I see in his eyes, determination. You and I have entered a marathon. Decide now what to do. To be continued. Thank you.